Today I want to talk about the eyelids. I've never had anyone come to me and say that they want everyone to know that they had plastic surgery. I've never had anyone say they want to look terribly different or have their eye shape totally change. Most patients want a natural result. They really don't want anyone to know that they had something done, but they want people to notice that they look bright and happy and well rested and youthful. When we're doing surgery on the eyelids, nobody should know that that took place. In other words, the scars are almost invisible. The shape of the eyes should be the same as they were before. And we're just turning back the clock and getting your eyes looking more like how they used to look. So what happens to the eyes over time? Well, of course, there's the aging process. If we focus on the upper lids first, what happens to the upper lids is that with age, we lose collagen and elastin. And so the skin on our upper eyelids elongate. And the only place for that skin really to go is to fall. And it can sit and rest on the upper eyelid where you can't really see that part of the eyelid. In other words, the part where eyeshadow goes or eyeliner. So a lot of patients say to me that they miss the fact that they can't wear makeup like they used to wear because the skin just gets rid of it. You can't even see it. The other thing that I hear from patients is it feels heavy. It feels heavy to have that skin sitting down too low. Sometimes it encroaches actually on the eyelashes. And then the third thing I hear is that skin on the upper eyelids makes their eyes look different. It gives them a different shape. It makes them look unwell or unrested or unhealthy or older than they feel. So luckily, we do have a solution for the upper eyelids. But my approach to the upper eyelid is a three-pronged approach. The first requires surgery. It is literally just removing the skin, and we can remove the skin in a way that scar is basically invisible. The scar is there, but we place it in an area where you really cannot see it. So that's number one. Number two is I like to tighten the skin up around the eyelids, build collagen, and make the skin healthier. And the way I do that is with laser. So I do love to combine eyelid surgery, the upper eyelids, with laser. And then the third point is very important, and that actually involves skincare. So I carry a very specific cream for the eye area. It's called Eye Enrich. It's full of great ingredients that will help rejuvenate the eyelid, help to build collagen, help to build elastin, and it works in great combination with the surgery together with the laser treatment. So that's my approach for upper eyelid rejuvenation and correction. So next, I want to focus on the lower lids. Everybody wants smooth, flat, fresh, healthy lower eyelids, but we're not all born with that. So when we're talking about correction of the lower eyelid, I like to think about a five-pronged approach. The first is surgical correction. So the beauty of surgery on the lower eyelids is you don't even see the scar. Why? Because that scar is actually inside the bottom eyelid. It's behind the lashes, inside the eye. We make little tiny openings, and that's how we get the fat out from under the eyes. And again, we want to be left with a very smooth contour, not hollow and still not full and round on the surface. That will help eliminate the shadows and that contour irregularity under the eye and better help balance the eyeball, the cheek and lower eyelid with the upper face. The second is laser treatment to help tighten up the skin. Usually on the day of surgery or the next day, I like to laser that lower eyelid skin, and we can go ahead and laser the whole face, the crow's feet up around the upper eyelid. That works so well with the operation. As we take the fat away, the skin is now really receptive to laser tightening. And so we have great lasers today that will tighten the skin, build collagen, build elastin, and you see the laser working for months, even months after the surgery. The third is PRF, which is platelet-rich fibrin. You can think of it as a liquid that comes out of your blood, and we can turn that into a solid filler. It's your filler. It's your body that's now converted into like a gel, and it can behave as a filler would behave, but it's better than a filler because what it does is it doesn't just fill, it actually stimulates the tissues that it's going into to grow on its own, regenerate and make new tissues and build collagen, build elastin, and have just a very healthy environment to, heal, to look young, to be tight, to be thicker. So this biofiller that we can make will actually fill a hollow, but it is then replaced with your natural own tissues that take over and replace it with you. So the fourth prong is sunscreen. UV, ultraviolet light, the sun, it thins our collagen in our skin. So it thins our skin, it makes it wrinkled, it makes it transparent, it makes it sag and hang. And under the eyes, it allows the fat pockets to just bulge out because they don't have a tight membrane over them. So with sunscreen, you're gonna help, if you're having a treatment done, you're gonna help maintain that treatment. You are gonna help prevent future damage. So I can't say enough about using SPF around your eyes. The fifth prong is Eye Enrich. That is an eye cream for the eyes, upper lids, lower lids, day and night. It has wonderful ingredients in it that will help boost your elastin, collagen. It has moisture. It will protect you from the elements outside, UV protection, together with your sunscreen, but also just pollutants and things like that in the air. It has anti-inflammatory things in it, and it is a wonderful adjunct to maintain and prevent further damage. One of the amazing things about eyelid surgery is the recovery is so fast. If we do just the upper lids, there's a little stitch that I take out, and 5, 6, 7 days after surgery, patients are free to wear makeup and go about their normal day. So the upper lid can have a little bit of bruising, a little bit of swelling. It's unusual, but patients who work from home, they're able to work the next day, drive the next day. There's just that little stitch that I'll take out 5, 6, 7 days after surgery. The lower eyelids, the downtime might be just a little bit longer than the upper eyelids in that there tend to be a little bit more swelling, maybe a little bit more bruising. And if we're going to combine either the upper or lower eyelid with a laser treatment, that can add a little bit onto the downtime as well. But like I said, if we use the regenerative medicine techniques that we have at our disposal today with PRP or PRF, we can speed up that recovery process to where the downtime is much less than it was before. Sometimes patients will do their upper and lower eyelids all at the same time. We call that a 4-lid blepharoplasty, and that's just a wonderful time to get everything done at once. It's easy, it's quick, it's one surgery, one recovery, and I highly recommend doing them both together if you feel like you need both your upper and lower eyelids corrected.